Good morning and welcome to Get Enlightened with me, Lauren Scott. I'm so excited to have my friend Max here. He is incredible. Welcome to the show, Mr. Dr. Max Mox.
Thanks for having me, Lauren.
I'm so glad you're here. I'm so glad to catch up, and I'm so glad to share this story with everybody because I really do think that it's just a beautiful story. So, welcome to it. Let's start where we met. I met Max. How many years ago was it? Because it was y'all's second trip, right?
Oh my gosh, that was the first time we went. I think it was around 2015, 2016, maybe somewhere in those 2 years there. So it's almost been a good 10 years here, dear.
Yeah, because we went together. We traveled 3 trips together, right? 3 trips.
Yes, I believe because you weren't going to come the third trip, and then we said, you know what, let's do it. And then, yeah, and then I think COVID hit. Yeah,
Yes,
so that would make sense.
Max and his dad. I call him Doc. Y'all hear it. They were one of the first groups with the University of Pittsburgh. Correct. Correct. Am I
Yes,
the
that's
University of
correct.
Pittsburgh Dental School to bring the first group over to Bride Island Outreach, and I was serving on the board, kind of as what would we call me, the activity coordinator.
Yeah, I think that's solid right there. Yeah.
So I wanted to bring you onto the show to really talk about like how y'all find Bride Island. What was your reason on getting involved? How it got involved? Because I know the story, but let's share it with the world. So it's up to you.
Take it
Let's
away.
take it away.
Yeah. Okay, so actually, we weren't the first group from Pitt to come down. It was one of the fourth years when I was a freshman at dental school who did it. So it was probably like 3 years before ours. They had a group come down, which I was completely unaware of until I got in charge of the fraternity there. But they started that, and they had the one. So who the president was, his name was Ryan. He actually got in touch with me when I was a second year, becoming a third year, and he said, "You should really do this. These guys are awesome. Let me put you in touch with them." And he put me in touch with Jonathan and Eric, and lo and behold, we got to talking, and we planned this trip. I think it was like 8 or 10 of my close buds to, go down and actually get to experience this, which was great because in dental school, when you go from second to third year, you get very much less into bookwork and very much into clinical.
Mm-hmm.
So, it's sort of just like throwing us into the boiling pot of water. So with these mission trips, just sort of how it's geared up is you can go on these between your second and third year, and you can actually get some clinical experience down in these. So like there's a Honduras, there's a Jamaica, there's a, Dominican Republic one, and you can get this experience of giving injections and working on these people who are so thankful for this work. They don't care that you're students, and you're overseen by doctors. So you're doing good work still, but you get to at least, get your hands wet and get to experience, a couple fillings, a couple extractions, get to work with, injections before you're just thrown in, the States here where, everyone's kind of looking at you, big googly eyed, like, do you know what you're doing?
Yeah. Well,
So,
I thought it was so interesting. So for our listeners, Bright Island Outreach was a charity that I always called it like cowboy dentistry because it,
oh, I think any of those mission trips you go on down there, it's not only Bright Island, it's fly by the seat of your pants. You got to work for these people and you got to give them the best treatment you can. And I'll tell you what, those conditions down there, they're not the best. So
they're
it's,
not.
you got to work with what you're given, and it's cowboy up, baby.
And we did. I want to say on the very first trip that I went with y'all, was it 800, 900 people that were seen that very first time? Is that a
I
good?
get all the numbers confused, but that was, like I said, we only had 8 or 10 guys, I think, come down. And then fortunately, the dental school down there came and helped us. So we banged out a lot
I
for,
mean,
just
I
the
have never seen
numbers.
anything like it because that was my very first trip was with y'all's group. So I guess that's why I thought that that was y'all's first trip too. Um, my very
Which
first.
is fine. I mean, for our generation in the dental school, yes, it was. So it's, that's not a wrong statement whatsoever.
Well, and your group was so kind, and the best. I think I went on 6 or 7 different schools, and y'all's were the ones that I kept going back to with because
Okay.
we had so much fun. But
Yeah.
um, your students actually they knew their shit. You know, it's you were talking about how you're only in clinicals, you're not really doing the work.
Right.
Tell them how what you mean by that, because it's one thing to learn it on a computer screen, but I feel like dentistry is something that you would really want
Exactly.
to get your hands like actually doing it.
It is, and it's it's one of those things. So dental school, and it's very much any other, medical school is the same way. The first half of your schooling is all bookwork and all learning pharmacology, learning biology, learning anatomy, learning all those specific references. But yeah, that helps, but you kind of have to throw it, not, I want to say out the window, but there's a certain advantage to getting in the clinic and actually working on people, because they teach you how to prep things on plastic teeth and plastic simulators.
Mm-hmm.
Nothing cuts like a real tooth. Nothing's going to cut like it's the same as, you can use pig skin or, whatever the medical school uses, but nothing's actually going to cut like human skin or anything like that. So the only way you really get to experience that is through clinical and through working on people, which they kind of just throw you into it, and it's, trial by fire. And like I said, you have docs, sort of holding your hand and teaching you. But good example, injections, the lab you learn injections, which I laugh that patients don't know this, we practice on each other. They
Yeah.
say, grab a partner and you're going to inject each other. And we're sitting there, needles shaking in hand, because yeah, they said, oh, you feel for the ramus, you feel for your jaw here and there, and you aim for this spot, but you don't know until you're in there. So and like I said, they call it stab lab, the kids do, which is awful, but it's kind of true. But you just go and you do the different injections on basically your friend, and then that's it. That's all the practicing you get. And then you're thrown into the real world, and here's a patient. Go.
So,
And
do you
it's a
think
little, it's,
you have to take these mission trips? Like, are y'all required to take a trip or?
So you don't have to take these mission trips, but I think it is so advantageous to take them, because like I was saying, then you get, especially in between your second and third year, when you are starting to go into that clinical realm, that you get to, work on patients. You get to, get the needle in hand, do more than one injection, you
Mhm.
get to get the idea of how pulling a tooth works and the steps to do that. You get how, you just get a better feel for drilling and for fillings. And, even then, the great thing about Bright Island was we were doing root canals,
Yeah.
so kids are, were able to drop into one or two teeth. And here's the more political realm of dental school is these kids aren't getting a lot of requirements. There just aren't a lot of people coming into the dental school because everybody has insurance now.
Mhm.
So they're not getting a lot of hands-on work. And when they come out of school, they're not adequately prepared. And it's up to the residencies or the dentist that, hires them on to sort of take them under their wing and say, hey, this is how this is going to work now that you're out of school. Cause that's, like I said, that's a whole nother thing, is now you're not cutting through red tape and having, these step-by-step procedures. It's how much can you get done in the time that is allotted so this person gets the best treatment,
Mhm.
you know? So like I said, that's just pitfalls of politics in school and, everything, which, that's a whole nother topic though. So,
I feel like we should do a follow up on dental school. This is what you should, because I mean, it's not something that normal, unless you're in it, you don't really understand it. You have no idea about
absolutely.
it.
And,
That was one of
that's
the
the
biggest
thing.
things that I remember with y'all is sitting down with y'all, talking and asking questions, because God knows, I've always interviewed.
Right.
But like asking those questions, because dentistry was, I had no idea, nothing.
Oh, right. Yeah. You came from the football world or the baseball world, I believe. And you
No.
were just like, oh, this is, a philanthropy event that I can, look for. And I was like, well, this is going to be a whole
Oh,
new realm for you to
it was,
bat.
and I got to help. I mean, it
Yeah.
was
You were cleaning instruments. You were a go-getter. You were getting your hands dirty
I was
there.
getting my hands dirty and all of it. It was so much fun. It's I've done a lot of charity and a lot of international charity with Food for the Hungry for Bright Island. Um, but Bright Island, the dentistry part of it, I actually loved. Like I tell my son, dentist is a good job to go down. Like,
I mean, there, you know what, and there are pros and cons to every job, but it is, and it's, you have to like it though. Like today, my schedule was insane, and my assistant was ready to shoot me, I'm sure, and but that's what happens. If you don't have cancellations and stuff, you have to try to get these people in and get them at least seen. And sometimes, yeah, you are running around like a chicken with your head cut off, but that's part of the job, and that's like I said, any job.
so what is the difference in um the schooling that, because how long have you been out? 7 years? So 6 years?
I graduated in 17, so it's been 6.5. Yeah, it'll be 6.5 for a little bit.
Do you see a big difference in the generational from when you were there to now, even in the LGBTQ community? Um,
Um, LGBT, yeah, yeah, definitely in that community. However, I think COVID screwed a lot of things up, so it's not even fair to compare at this point
yeah,
because things have changed so much that it's, I ask the kids now, I'm like, what's going on, and everything they say is not, anything like what we went through. So I think that's just administration change, and I think it was COVID and dealing with COVID. And so unfortunately, I don't think it's fair to compare, from a, LGBT, wow, I'm getting my letters mixed up. They added something. But from that standpoint, it's nice to see that there's a club now for it, and it's becoming a lot more open, and I think that conversation has opened up a lot more to make it easier on people. Not that my generation had it so hard, but the generation before me, even,
yeah,
so
like your dad's generation.
so it's definitely, even when I was going through it, opened up a lot more. But even now, seeing everything, you see that rainbow flag everywhere, which is great. It's now on the top. People are talking about it and respecting, attempting to respect it. Let's say that. So it's definitely nice to see.
What about in the dental world with AI? Because in the medical world, there's a lot of AI that's been around for the last 10 years. It's been filtered in. But with the dental world, do y'all use a lot of AI? Do you think that it's going to go AI? I mean,
It's absolutely going to go AI. They sometimes consider us in Pittsburgh here in the Rust Belt. It's a little slower than, what they're seeing in LA and Vegas and, all that, New York. But where things are going, I mean, you're scanning teeth now. You're not taking impressions anymore.
mhm.
You're sending that scan to a 3D mill machine that is in your office now, and you can work up the crown on the computer screen in front of the patient and show them what you're doing.
I just had
Now,
that done 2 weeks ago. It was crazy. It was crazy.
but then you have, generational dentists like my dad who are still doing impressions, and they don't care to learn AI because they're going to be retiring in, 5 years. So there are different things you see. The new thing coming down the line is 3D printing. I know a lot of the schools, you're now taking, if a person has an existing denture, you can take a wash impression, they call it, and you can actually scan the inside of the denture so it is on that scanner, and you can now 3D print dentures.
Wow.
So it's going to be very interesting what AI has to offer in the future. And, that's why we have to do CE credits. That's why you have to do continuing education, because things are constantly changing. New things are coming out, which is also frustrating because you get one piece of technology that's really expensive, and 3 years later, they're like, oh, well, we have something newer and better. Do you want to trade yours in? And I'm like, I just spent X amount of thousands of dollars on this machine that's not even 3 years old,
Wow.
So it's fun, but it's sort of, things are constantly getting worked on, which is great. But at the same time, you got to keep tabs on everything because everything's constantly changing.
Well, with that being said, what would you say to any young dentists that are just starting out, trying to get into it? What would be the top 3 things that you would tell them going through school, coming out, and whether they start their own business or get under another practice, what are those top three kind of?
Going through school, I always tell the kids, I say, put your head down and learn the ropes, especially that first year in clinic. Just do what you're told. I don't care if the teacher's mean. I don't care if they're making you do every little, piece of work. It's put your head down, learn the way of the land, and then you can start trying to cut corners. Don't try to go in there and be a big shot and cut corners and tick the upper class students off who, you might be trying to steal a patient or something, because then you're just ticking everybody off. And then it's a small community, so word gets around and it'll just be ugly for you. Teachers know. Teachers will not that they don't like working with you, but it's just they make your life harder because they know you're trying to, beat the system. So put your head down, do what you're told, enjoy working with the teachers, let them teach you, know who the, teachers who are, I hate even saying this, the teachers who are there to teach, they enjoy teaching. They did their clinical rounds. They know that, use them to your benefit. Don't try to cut those corners right away because it won't work out. Secondly, I would say when you're about to graduate which, like I said, I'm not sure how requirements are right now, but definitely go into a residency would be my best suggestion. I was very fortunate that I had my dad, and I went right into working, which I don't regret. And I have friends that did it that don't regret it. But my dad is a generational dentist, like I was saying, and he doesn't do implants,
Yeah.
he doesn't use scans. So, where I could have gone to a residency and learned scanning procedures and learned how to place implants and, been under somebody who does that and made it a little bit easier for me, that would have been a lot nicer. So definitely, look into residencies or, I know a lot of hospitals, VAs do that. So that would be my suggestion. And then as far as owning a practice, it's totally dependent on you. I know you and I were talking this before we got on, but I've learned that I don't like managing. I don't like, my dad was my dad was an owner and he, we're both type B more so. And I like walking in, doing the dentistry that I love and walking out. And that doesn't happen when you own an office. If our furnace just went down, it's getting cold out. Hey, I had to call a furnace person and be there when he called back. It's office, it's business, it's, things that they don't teach you in school. So you really have to take that into an account. I have friends now that we're 6 years out that are buying practices and they're going, oh my God, I never thought of this. And I went, yeah.
Well, I think they think, oh, it's going to be our practice. The money's going to be huge. They,
And the money does get better. That is a very good incentive to do it. However, you have a lot more responsibility. And like I said, it's just weigh your pros and cons. I mean, it's, there's a niche, there's like a little niche for everybody. So it's totally, don't be too quick to start, even though I know some people that are doing very well that got practices, 1-2 years out of school and they're franchising now.
oh,
So it's,
nice.
yeah, I mean, there are some people doing very, very well. So it depends. And, it depends what area of the country you're in. Like I said, Vegas and LA, you're doing veneers and crowns and all this aesthetic work, the Kim Kardashian smile. Here, I'm lucky if I can get a veneer on, 20 minutes, 30 minutes outside of Pittsburgh because it's not covered by insurance.
Yeah.
So, that's another little tidbit. It's, what do you want to do? What do do you want to focus on implants? Do you want to focus on, veneers? Do you want to focus on dentures and prosthodontics? There's a whole lot to think about when you get out of school that you don't realize.
Well, I think that's a good start on to bringing that forward with students because it isn't something that they think about, and it is something that I know we all talked about even around roundtable discussions when we were on the mission trips. Is how it shocked the third year students that they were actually having to step into, oh my gosh, what am I going to do
Right,
next year? You know what I
right.
mean? Like it's
Yeah.
not something that's taught in school. Like
No, it's not. And it's, that that would be one more class that you don't want to take, and that'd be one more class that you'd fall asleep in. But honestly, that's the class that you probably should pay the most attention in, so
mhm.
It's tough. And then, like I said, then you can get into curriculum and all the good politics of school and everything. But that's for another day.
Well, let's shout out your socials. Where because you're in Pittsburgh, so shout out everything. Tell them where to find
Okay.
you.
So my socials where my business is on Facebook and Instagram at Doctors Mock Associates. And then my personal, I'm on Instagram as General Maximus. And then I'm on Facebook as Max Mock. So
Y'all go follow him. Him and his dad are the best. Like seriously, I'm so glad that you're here. Thank you for giving a little intel to like what dentistry really is about. I just
absolutely.
and hopefully we've reached somebody who has either a child or is fixing to go to dental school, and this can give them a little bit of an idea of what to look for, some things to do, you know?
Yeah,
This is the
absolutely.
goal.
Yeah, no, and like I said, if anybody's looking for a mission trip, just look out there. I mean, there's Bright Island Outreach, absolutely. Reach out to those guys, but there's tons of them out there, and it's not only dentistry. I know we've had optometry guys go down there. There's a bunch of stuff that you can do that, helps third world countries like that. So,
There really is, and it takes big hearts to do what y'all do, so thank you so much, Max.
absolutely. Thanks for having me, Laura.
Love you, love you. Give your love to
Yeah.
give the love to your dad, and thank you everybody for listening to Get Enlightened with me, Lauren Scott. See you next week.